Bacterial antibiotics are a type of medication used to treat infections caused by bacteria. They work by killing the bacteria or stopping their growth, helping to clear the infection. However, while antibiotics can be a life-saving treatment, they are not without risks. It is essential to use them carefully to prevent the development of antibiotic-resistant bacteria and other potential side effects. What are bacterial antibiotics? Bacterial antibiotics are a class of drugs that kill or slow down the growth of bacteria. They are often used to treat infections such as strep throat, pneumonia, and urinary tract infections. Antibiotics work by targeting the specific structure or function of the bacteria, preventing them from multiplying or killing them outright. Antibiotics come in many different forms, including pills, creams, and injections. Different types of antibiotics are effective against various types of bacteria. Some antibiotics, such as penicillin, are broad-spectrum and can be used to treat a wide range of bacterial infections. Others are more specific and are only effective against certain types of bacteria. How to use antibiotics carefully. While antibiotics can effectively treat bacterial infections, they are not without risks. Overuse or misuse of antibiotics can lead to the development of antibiotic-resistant bacteria, which are more difficult to treat and can spread more easily. Here are some tips for using antibiotics carefully. 1. Only use antibiotics when necessary. Antibiotics are only effective against bacterial infections, not viral infections like the common cold or flu. Taking antibiotics unnecessarily can contribute to the development of antibiotic-resistant bacteria. Only use antibiotics when they have been prescribed by a doctor to treat a bacterial infection. 2. Take the full course of antibiotics. It is important to take the full course of antibiotics as prescribed, even if you start feeling better, before the medication is finished. Stopping antibiotics early can contribute to the development of antibiotic resistance. 3. Don't share antibiotics. Antibiotics are prescribed based on the specific bacteria causing the infection and the individual's medical history. Sharing antibiotics can lead to the wrong type of antibiotic being used or the development of antibiotic-resistant bacteria. 4. Talk to your doctor about alternatives. If you are concerned about the use of antibiotics or have a history of allergic reactions to antibiotics, talk to your doctor about alternatives. There may be other treatment options available that are effective and safe for you. 5. Practice good hygiene. Practicing good hygiene, such as washing your hands regularly, covering your mouth when coughing or sneezing, and avoiding close contact with people who are sick, can help prevent the spread of bacterial infections and reduce the need for antibiotics.